Hey, it's Mary Pennington. The first assessment that I chose was the TUG assessment, the timed up and go. And it is a falls assessment. And I think the reason why it is pretty commonly used and chosen over the other falls assessment is because it is free and it's quick to administer. You don't need a whole lot of equipment to administer this test. You just need a chair with arms on it and back that chair up against the wall. Have the patient sit in the chair, and you can run them through a trial before you actually begin taking the data. And you tell the patient, you're gonna stand up and you're gonna walk 10 feet to the tape on the floor. You're gonna turn around, you're gonna go back to the chair, and then you're gonna sit down. When I say stand up, I'm gonna start the timer. And you're going to walk all the way down. You're going to turn back around. You're going to sit. And the moment that you sit down, I stop the timer. And that's pretty much all there is to it. So you need a stopwatch, you need a piece of tape on the floor, and a chair. Now, the patient is allowed to use any assisted device that they normally walk with. So if they're with a cane, rolling walker, crutches, whatever it is, they're allowed to use it during this assessment. Some of the populations that you can use this assessment on are basically the older adult population. However, any patient that has a neurologic diagnosis, Parkinson's, maybe even a stroke or an amputation, anything that might actually put them at risk for falls, can it be administered this assessment? I know that the norms for a typical community dwelling adult is about 13.5 seconds. So all of the norms, all of the recordings will be, or all of the results will be recorded in seconds. And just compared to the normative data, and they actually differentiate for stroke patients, they have a different data. For an amputation patient, I think it's somewhere around the 19-second mark. So you can compare it based on what your diagnosis that you're assessing to those norms to see if they are a fall risk. And if they score higher than those norms, they're automatically a fall risk. And you want to then start putting the precautions in place, whether you're using personal alarms in a facility or telling their loved ones that they need to be supervised or assisted when they're making their transfers. And the second assessment tool for edema that I chose was the volumetric gauge. The reason why I chose this one is because it is probably the most objective, and data that you receive from that is quantifiable. It doesn't leave a whole lot of room for user error. So as you could get when you're measuring maybe circumferential, because a lot of times it's like, did you measure in inches? Did you measure in centimeters? Which area of the body did you measure? And if you don't exactly hit the same area, you may get a different reading. And that's with circumferential measurements. And with the basically finger poke test, I don't know if there's really a name for it, but test pitting edema, again, everybody's nail beds are probably different sizes. So I know you're supposed to see how far your finger depresses in there. And of course, if you let go and it stays depressed, then it's considered pitting edema. But if you're pushing in, some people may not push as far. They may not continue pushing. That test is, a little bit more subjective. And you would use this on anybody, maybe post-injury. If they're still in that acute inflammation phase, you can use it for congestive heart failure. You can use it for lymphedema, anything that would cause swelling of a body part. And what you would do is you're going to fill up this gauge. It has the numbers on it. You're going to stick that body part in the water, and water will be displaced into a separate cylinder. You're measuring the displaced water. The water that leaves that original container and ends up in the second container, and you can check this or recheck it over time to get an understanding of whether or not edema is decreasing. That's it. Thank you. Have a good night.